Hello friends, let us now learn some important points about the intercostal tube drainage insertion. Then intercostal drainage tube insertion. Then if you see, this intercostal drainage tube is inserted into the triangle of safety. So first these are the lungs, and here there is a pneumothorax or pleural effusion, actually pneumothorax. Then this is the tube and this is the underwater seal chamber. Okay. This is inserted in either triangle of safety, that is in fifth intercostal space in mid clavicular line or anterior to anterior axillary line. It is inserted in the upper border of lower rib. So this is underwater seal. This underwater seal will act only as one-way valve. It will allow the contents to enter in, but it will not allow the contents to go back into the pleural cavities again. Okay, the contents, that is the air from the pleural cavity, will drain into this container, but the air from this container will not go back. Okay. Then the patency of chest tube is mainly observed by the oscillations of the water column. Then the patency of the chest tube and resolution of intrapleural air or liquid is mainly checked by chest X-ray. With the chest X-ray, we will check the patency of air tube, chest tube and resolution. If the column, see there, I have said there will be a chest column, okay, water column, there will be a water column. If this water column has to oscillate, okay, if this water column oscillation is stopped, then it is either blocked or it has been displaced. In both these cases, you will have to confirm it with the help of a chest X-ray whether it is blocked or displaced, and then you will have to remove it and change the chest tube. Now, what are the indications of removal of chest tube? One, if the lung has been expanded, that means if there is improval of symptoms are seen, then you can remove the chest tube. Second, when the drain output is less than 200, that is 200, when the drain output is less than 200 ml in 24 hours, then we can remove the chest tube. This removal of ICD tube is done when the patient holds the breath at the peak of inspiration. When he holds the breath at peak of inspiration, then we can remove this intercostal drainage tube. Then ideal time of drain removal includes: 1, when there is thyroidectomy, you will have to remove it after 24 hours. When you do mastectomy, you will remove it after 5 days. In colorectal anastomosis, drain is removed after 7 days. In T-tube, you will remove the drain after 7 to 10 days. In T-tube fixation, we will remove the drain after 7 to 10 days. So this is about the intercostal tube drainage tube insertion. Thank you for watching.